Good morning, everybody. So I got my latest PET scan results back, and it was another mixed bag of results. Um, Overall, I'm not really sure what my doctor is going to recommend, but I'm going to request that we give this medication treatment another 3 months to see if it'll work, because I had at least a whole cycle. I missed a whole cycle, and I had dose reductions. So I don't think the medication really had a chance to do its full work. She may or may not agree to this. But so what it says here, I have my results here. I don't know if you can see, but there's my report there. So what it's basically saying is like hold on, I gotta change. So their summary says previously described hypermetabolic left pleural nodules are more numerous and confluent. I had to look up what confluent meant. And what that means is that the little nodules, whether they're tumors or whatever they are merging. They're clumping together, which is confusing. So I'm going to be investigating what that means and what it could imply. I also have an autoimmune disease which can cause lung problems. My nose is raw from having a runny nose. So I'm a little. I mean, I know it could be the cancer nodules merging. I know that, but what else could it imply? Doesn't always. I have other. I have autoimmune disease which can cause this. Sarcoid. Oh, I can't even say it. There's an inflammation disease that can cause something similar to this. So I'm going to be investigating to see if that could be the problem or contributing to the problem. The second thing they say is new hypermetabolic, which means it's more active. 1 centimeter, so that's about that big. Left axillary lymph nodes is suspicious for a new metastatic lesion. So the lymph node could be cancer, or it could just be from fighting an infection, which could be in the lung. Because I will get to that. New small focus of hypermetabolic activity, in the left hepatic lobe. So that's your liver. Your liver has different parts to it called lobes. But there's no visible CT correlation, but it's suspicious for metastatic lesion. So I haven't had a liver lesion for 5 years. So if this is a liver lesion, then that is concerning. But there's no CT correlation. It's just a hot spot. We don't know what that's causing that. And then number 4 says all previously described FTG avid lesions are stable or slightly smaller and less metabolically active. A small hypermetabolic left para-aortic lymph node and intramuscular lesion in the region of the left flank have resolved completely. Okay, so the one lymph node that was by the heart is gone. The one tumor that was in my left side, which I think has done nerve damage because I still have issues there, has resolved. So that means it's working, but is it working for everything? And what that could imply is I could have more than one type of tumor happening right now. So we know that I've been previously hormone positive, which I still was 2 years ago when they did a biopsy. It was still like moderately. But my HER2 status increased quite dramatically, so we started on HER2 treatments. So what it could mean is that some of these tumors may not be HER2 tumors anymore. They may be triple negative. So that's something to keep in mind, that your tumor status can change. I did a video on that, I believe, recently. So yeah. And then, as I read through this here, okay. So now here's some things that I haven't had issues with before that are new and somewhat concerning. So it says the new FTG avid lesion pleural effusion, pericardial effusion. So effusions are fluids around either the lung, that's the pleural, and the pericardial is around the heart. So So it says previously described hypermetabolic left pleural nodules are more numerous and largely confluent, which I already read to you. Small FTG avid anterior right pleural nodule is slightly less metabolically active, but otherwise unchanged. So I have a small nodule somewhere on, very small. Even the doctor couldn't really see it, and it's less active, and so it got better. It's not gone, but it's a little bit better. Okay, and then it says that I have a loculated left pleural effusion, which it's like a pocket of fluid. It's not like free flowing. So when I lay down, a free flowing fluid kind of would fill the back. But when you have a loculated, it's like a pocket of fluid. It doesn't move around so freely. So, but it doesn't say how big it is. But what it does say is I have a moderately sized pericardial effusion, which is, it's more than a mild, but it's less than severe or large. So it's a medium-sized amount of fluid around my heart, which is kind of surprising because I don't have any. I've had pericardial effusions before, and they cause pain for me, but this one's not causing any pain, which I find kind of perplexing. But when I try to leave my left side, I notice I'm out of breath, and I can't lay my left side for more than a few minutes, and I roll over my back, and I'm fine. So I think that might have to do with the pleural effusion, loculated pleural effusion combination with the pericardial effusion. Together might be kind of irritating stuff. Okay, so then it says, okay, so the lymph node part of it, it says previously described hypermetabolic left axillary subpectoral lymph nodes and mediastinal lymph nodes are slightly less metabolic. So I had a lot of lymph nodes here, and lymph nodes along the spine, by the heart, and in between the lungs. I had a lot. And what it's saying is a lot of those have shrunk a little bit and are less active. So that tells me the treatment is working for that stuff. Maybe not as good because I guess I had interruptions and dose reductions of my treatment over the last 3 months. So that, I think, had an influence on this report. And then it says, after that, it says there's a new 1 centimeter left axillary lymph node. It's about 1 centimeter, and it's moderately active. So it says an SUV of a 6.9. Well, some of my tumors were like in the 20s, so 6.9 isn't super hot, but it's warm. But it's a lymph node, and lymph nodes can also get hot because of infection, which could still be linked to the lung issue. So whenever my reports kind of like say lymph nodes are the problem, it makes me wonder, but when something else is getting hot, like possibly the liver being an issue, then I get more concerned about that cancer being the cause. All right. The lungs, it says FTG avid airspace disease in the left lung base, similar to the prior exam. So that didn't change much. No discrete FTG avid pulmonary nodule. So there's no really obvious tumors inside the lung tissue itself, but the basilar atherosclerosis, I can't even pronounce it, limits evaluation of pulmonary nodules. So there's some thickening of the sac, probably from the effusions and other things that are making it hard for them to tell for sure what's going on. So if they really wanted to know, they'd probably have to do another MRI or CT to get a lot more detail. The right chest, okay, that's just for the port. It talks about the port being in the right place. Pancreas is good. Adrenals are good. Kidneys are good. GI tract is good. In the abdominal area, it says I have multiple FTG avid lymph nodes that are either stable or smaller. So again, the lymph nodes that I had in my stomach area are stable or smaller, which is good. So that means the treatment's keeping that under control. And when you have stage 4 cancer, control is what you want. Sometimes you can't get rid of it sometimes, but if you can control the growth, then we're good. Let's see. So it gives us some examples. It says there's a 1.7 centimeter gastrophoretic or hepatic node. Its maximum brightness was 9.4, but it was previously 1.9, so it shrank a little bit. And that one was the 22.5 SUV. So now it's only 9.4. So it's like less than half as bright as it was before. So its activity went way down. Then that was the one by the liver. It's like it's a little, can't really describe it, but it's in you know, the liver's in your stomach area, and it was near the liver. So that one's a lot quieter. And there was a 1.3 centimeter left para-aortic nerve. So that's para means it's next to the aortic aortic valve vein that runs down to your abdomen. You know, the right in the center. If you put your hand right in the middle of your stomach, you can kind of feel the heart beating. That's your aorta. So there was a lymph node near that, and it measured its max brightness was 8.7. Previously, it was slightly larger at 1.4 centimeters rather than 1.3 now, and its brightness was 11.2. So its activity level went down. And then it says the left aortic nodule has resolved. They said resolved twice. So I guess there was more than one, and this one of them is completely gone. So that's good. That's awesome. Pelvic organs, there was nothing in there, no fluid in the stomach, which is good. Musculoskeletal area. So it says hypermetabolic bony lesions described previously are slightly less metabolically active. For example, the L4, which is your lumbar, which is your lower back vertebrae body, it says the max XUV measured this time was 4.6, previously 5.8, so it's less active now. The right iliac bone, or you can think of it as part of your hips, its max brightness was 4.2, previously 5.1, so it's slightly less active. And the left iliac bone measured 5.7 this time, before 9.2, so almost half of bright, so that's great. So you can see it's a mixed bag of results. It's mostly like the lung that's having the issues, and that little hot spot by the liver or in the liver. They're not exactly sure what's going on with that one, so I'm not going to use that as a determining factor until it actually starts showing as a tumor. And it hasn't affected my blood results. My blood results have been getting better. My liver functions have been improving, so it's not like it's affecting my liver yet. All right, and says, so the last thing is soft skin tissue. The hypermetabolic intramuscular focus in the left flank has resolved, which we already know. I think that was the last one, yeah. So a mixed bag. So like I said, my treatment over the last 3 months, so I have started with, it was the Herceptin's been ongoing for 2 years. That's the HER2 targeted treatment. So, but in the last 3 months, I started the new treatment, which is Tukysa, and 5FU, which is the chemo part. So the Tukysa is a targeted kinase inhibitor, which is a targeted therapy, and the 5FU is the chemo part. So in the beginning, they had me on the normal dose of both of those. They were both pill forms, and the pill form of the chemo gave me severe diarrhea, which sent me to the hospital with dehydration. They had to hydrate me, and I got better, but we had to stop that. So we took a whole cycle off. We took 3 weeks off of both medications. So for one of the 5 cycles, I can't remember how many cycles I go through. I'll figure it out later. We didn't have any treatment except for the Herceptin. So I wasn't getting treatment for that. And I stopped the Tukysa a little bit early too, because I was so sick I couldn't even eat or drink. But then they put me back on after like 3 weeks off of both medications at a lower dose. And then the chemo part became an IV rather than a pill, which was a lot better for me because I had the side effects were a lot less. But however, we were doing it at 3 week cycles when you're supposed to be doing it at 2 week cycles. And we did that for, I think, 3 cycles, where we did it every 3 weeks. And so basically, I was getting less medication less often. So the drugs really didn't have the full chance to show us what it could do. And then just the last cycle, we went to 2 weeks, which is supposed to be every 2 weeks. That's what the drug calls for it to be, considered working properly. And so really, this last 3 months, it hasn't been a good, consistent window of treatment to evaluate whether or not that medication is going to be able to keep me stable or improve. Like some of the things improved and some things it didn't improve, like the lung stuff. But the lung stuff could be from the autoimmune. It could be from infection, which I live on a ranch. I'm exposed to feces of all kinds, birds, rats, mice, you name it. So I've in the past had lymph nodes come and go in scans on the same treatment. And so, not knowing what the lymph nodes, why the nodules are doing what they're doing, is kind of confusing because those nodules can be caused by more than just cancer. So that's going to be something I'm going to want to explore with my doctor and then also explore online. I'm not seeing the images. I can't really see and compare other images from other, like sarcoidosis. I can't even say it, darn it. It's inflammation inside the lung area. So, and I've had high inflammation for quite some time. So I know I have inflammatory problems, and it's not just due to the cancer treatment. I've had that all my life since I was, my early 20s. But inflammation is bad for cancer. And it indicates that your immune system is doing things that it shouldn't be doing. It's attacking tissues or something's trying to heal or something is under attack, So inflammation, when it goes unchecked, can cause a lot of damage. And that could be part of what's going on in my left lung. But only way to do that is if they go in there and do a biopsy of some of these nodules to see what's going on. But that's, that can be a dangerous procedure because you could puncture the lung and cause a lung collapse and infection. So it's one of those things where maybe just be better to wait and see what happens. If I start getting symptoms of a problem, they can do a quick scan and say, oh yeah, well, we need to change your medications now. But as of right now, I don't feel like I need a medication change. And I don't feel that we've given this treatment a full opportunity to show us if it can be more continuously beneficial for me or not. I'm not ready to give up on it yet. But the same thing happened with my last treatment, the Kadcyla. But the Kadcyla gave me some pretty strong neuropathy, which is numbness and tingling in my hands and feet. So I wasn't too sad to get off of that. But that's something that I might be able to go back to because it was helping some of the things. Other things it wasn't helping, but some things it was helping. So I'm not sure really what's going on in that left lung and in that little spot in the liver. Those are the two spots, the two things that I'm, iffy about. Like what's going on and, is it cancer? The spot in the liver, and once I see the scan, I will have more confidence one way or the other. Maybe not completely like, oh, it's nothing to worry about, or oh shit, that's something to worry about. But I'll have to wait and see. But the only things I've been really having issues with, my sleep has been kind of interrupted, a lot of urinating at night, runny nose. Whenever I start walking around, like right now, it's not running. But whether I'm inside or outside, as soon as I start walking around, my nose starts running, and that's why it's a little raw looking there. Because it's literally raw. When I start moving around, my nose runs continuously. I go through. Like these are those little paper towels with the Viva ones are like cloth. Those will be soaking wet within an hour. And it's just like, what the heck? My poor nose is just dying. And then I've been having some crackling and wheezing in my lungs, but that's again probably from what's going on with that loculated pleural effusion and dehydration because the sacs need to be lubricated, and if they're kind of sticky, they need to stick to each other and make a lot of noise. But then I also have the fluid around the heart, which could also be, putting a little pressure on the lung too, so it's squeezing a little bit. But, overall my energy levels have been better, except for when my diarrhea gets bad and makes me tired. But once I eat and drink, and it comes back relatively quickly. But overall, I feel better for the most part. Things are under control, so I'd really like and hope the doctor will agree to give this medication one more PET scan cycle, which is 3 months. And in 3 months, things haven't gotten out of control. The left lung thing, it is concerning, but I think there's other influencing factors. I did have heart failure for the last year or so, but it's recently improved dramatically. Back in the normal healthy range. So the heart failure is under control. It's gone, essentially. So, so, you know, I'm able to function and get stuff done. I just had to take it at a nice steady pace. I don't work too hard. If I exert use too much muscle, too quickly, I do get winded really fast. But then if I rest for a few minutes, I'm fine. I'm back to normal, back to nice, easy pace. I call it putting around. So, anyway, so 3 days from now, next Wednesday, this is Sunday, I will meet with my doctor and we'll determine from there whether or not we're going to be changing my treatment or not. I hope not. I'd like to give it another 3 months. Since the cancer's not growing out of control fast, I think 3 months isn't too much to ask. And then in 3 months, if things are continuing to get worse in some areas, I think, but better in others, I think it's going to be a good indication for a new biopsy time for the areas that are growing, because those could be triple negative and they might need different chemo. But we don't want to stop treating the HER2 positive ones, so we still want to do that. But we might need to add a different kind of chemo to knock out the triple negative tumors if that's what's starting to happen, which is a possibility. Eventually, if we kill off all the HER2 tumors, only thing that'll be left are triple negatives. And those are a little harder to treat. They would be more aggressive treatments for those because there's no targets on them. However, I still have the PIC-ray treatment that I still can do. That's in HER2, which is another positive treatment. People have said this works really good for them. So I still have a couple of lines of treatment to go that aren't HER2 or hormone related. I think that in HER2 is a HER2 positive treatment, but the PIC-ray is not. It's a mutation related treatment for a certain mutation on the cancer cells. So that one will be in my works no matter what. And it's just kind of a nasty one. It messes with the blood sugar pretty bad for some people. So anyway, that's where we lie right now. A little disappointed it wasn't better, but I'm not surprised because of all the interruptions and the changes and such. So Wednesday we'll know more. I'll keep you guys informed. And if you find this interesting or think it might help somebody you know who's going through cancer, please share the video. I do have a Facebook page, Life with Stage 4 Cancer, which I do little posts more often than I make videos. Anyway, thanks for watching. And remember, make every day the best, because none of us know when our last day will be here. It could happen to anybody anytime. Just because I have cancer doesn't mean we stop living. All right, guys, take care. Find your joy. Share your joy.